Some doctors are concerned that the results of a study published Tuesday could harm women. The Canadian National Breast Cancer Study questions the benefits of getting a mammogram.
Yeah, researchers say the data also indicates that patients who get mammograms that detect cancer are sometimes overtreated for the cancer. It's a vast study that involves about 90,000 participants, and they conducted it over a quarter of a century.
Christine McCarthy is covering this story for us. And Christine, this is not at all what we've been seeing on billboards and in breast cancer campaigns.
That's right, Mark and Shauna. The conclusion of this study recommends that doctors and patients reassess the value of mammograms. But one local doctor is convinced this study is flawed.
I thought, not again. Do we really have to defend this again?
It's another study that deepens the divide between the pro-mammogram camp and the skeptics.
There really is great polarization about mammography now.
But this study, published Tuesday in the British Medical Journal, includes nearly 90,000 Canadian women over 25 years. The conclusion, annual mammograms don't reduce death from breast cancer beyond physical exams. Dr. Brett Parkinson, director of IMC's Breast Care Center, believes the findings are harmful to women.
I know that there are some women out there who will forego having a mammogram because of this study.
For at least 23 years, Parkinson has pushed mammograms.
We have definite proof that mammography saves lives.
KUTV is running a breast cancer campaign.
Mary Nichols, news anchor, mother, wife.
Teaming up with the Utah Department of Health to urge women to get screened.
Not a lot of people can say their job saved their life, but mine was truly saved when I got a mammogram for a TV story.
This study is fundamentally flawed.
Parkinson points to a selection bias and a contamination bias with the participants. The technicians and radiologists, he says, were insufficiently trained.
As the physicist who was involved later said that the quality of the mammograms was substandard. It was not state-of-the-art even for the 1980s, and he withdrew in protest.
Parkinson's advice remains. If you're 40 or older, get a mammogram, he recommends, until your life expectancy is 5 to 7 years.
But I'm here. I'm alive, all because the cancer was caught early by getting my mammogram.
And some of those data, 25 years old. Of course, Dr. Parkinson says that we now have newer tools and that the mammograms used in that study were analog mammograms. We now use digital mammograms. Another reason he says this is a flawed study and it's just bad science. Back to you guys.
All right, Christine, thanks.